Have you ever taken a pain medication? Ibuprofen or aspirin, for example? Ever wonder where that medication came from? Chances are that medication or any other medication you may take comes from a pharmacy, whether over the counter or with a prescription. But what do these pharmacies do? How do these pharmacies guarantee maximum customer satisfaction? They do it through pharmaceutical schooling. And with that schooling comes the three specialties within the pharmaceutical industry, which are hospice, compounding, and pediatric pharmacists. According to the U.S. Bureau of Labor, there are approximately 321,000 pharmacists who get certified to practice pharmaceuticals every 2 years. The Pharmacist Times states that pharmacy care services save approximately 112,000 senior lives every 6 months, not including the lives of people from ages 1 through 60. But why is this of importance to you? It's because every single time you or a loved one goes to a doctor and gets recommended a specific type of medication, your local pharmacist is always ready, prepared, and equipped to give you that specific med. In my ancestry, my father and my mother have both taken the pharmaceutical career path. My father has owned a private pharmacy corporation since the year 2011, and I've been working as an intern there for 2 years, and I'm less than 1 year away from getting my internship paperwork. Today, I would like to discuss some of the many specialties under the pharmaceutical department, those of which being hospice, compounding, and pediatric pharmacists. To begin, let's discuss HPs, otherwise known as hospice pharmacists, which are one of the many specialties in pharmaceuticals. Hospice pharmacists treat terminally ill patients with their cares and needs. Hospice pharmacists learn about which kinds of medication are approved when taken together and which kinds of medications have bad interactions, which can cause unexpected side effects or an increase in the action of a particular drug, as stated by the Intermountain Healthcare Services. Consequently, they make sure that their patients get the proper dose of medication as prescribed by their doctor. Furthermore, HPs discuss different treatment options with their patients. This can be talking about the side effect and the stigma of a medication, but HPs can also discuss programs with planned out steps necessary for the patient care. HPs can prescribe MTMP, otherwise known as Medication Therapy Management Programs, which are targeted to deal with individuals under a chronic care improvement program, as referenced by the Center of Medicare and Medicaid Services. Hospice pharmacists can also aid with end-of-care or end-of-life stage care programs. Likewise, another specialty of pharmacists, entitled compounding pharmacists, also take care of patients. Compounding pharmacists create mixtures of drugs that can aid the patient. Compounding pharmacists create these mixtures for patients who can't be helped with FDA-approved medication. The U.S. Food and Drug Administration mentions that compounding pharmacists oftentimes do this for patients who are either allergic to certain dyes in a specific pill or elderly patients who need an oral suspension of a pill. Compounders also develop medication for patients that need immediate care and request a more effective one than the one that they currently take. Compounders can make medication that can treat 2 or more areas of need for the patient. Compounded medications include the components of 2 separate medications for patient preference as ordered by the doctor. Also, these medications often include more side effects and risks than normally prescribed medications, but most times they result in better effects than ones found with prescriptions. Lastly, oftentimes compounding pharmacists work side by side with pediatric pharmacists who deal with patients of young ages. Pediatric pharmacists provide care to children and specialize in the needs of kids rather than the needs of adult patients. Pediatric pharmacists train up to the age of 18 years old. They provide care to children, including providing alternative dosage forms, as mentioned by the Board of Pharmacy Specialists. Pediatric pharmacists are needed to make a proper decision about the patient care and health because the patient may not have enough knowledge to do so themselves. They claim full responsibility over their patient's health. Pediatric pharmacists create specialized drug therapy monitoring required for pediatric patients. They can monitor chemotherapy, high-risk meds, allergies, and antibiotics. In my short time I was working as an intern, I see that all the specialties of pharmacy are equally important to the patient, whether it's hospice, compounding, or pediatrics. Regarding hospice, the terminally ill patients give their ultimate trust and authority over their lives to hospice pharmacists. Compound pharmacists most times act as wizards or magicians and formulate new recipes for a new mix of medication. Moreover, pediatric pharmacists work with ages from 1 to 18 and help guide their patients with treatment courses they may not be able to make for themselves. So in a few years, if you find yourself in need for a refill for a certain prescription, make sure to stop by your newest general pharmacist, Dr. Merlamina. Thank you for watching, and I hope you enjoyed.